The TV was still glowing, his robe was still open, and there was a calm emptiness in the room, the kind of stillness that only comes after something irrevocable. When they discovered him slumped forward in his recliner alone, with no evidence of harm or cries for assistance. For those of us who are aware of the symptoms, there was something else, even if the autopsy claimed natural causes. Hormonal breakdown and silence. Something harmful starts to happen when you go for extended periods of time without any stimulation, especially around the age of 60. The flow of blood slows down. Delivery of oxygen declines. The tissues start to stiffen, not in a positive way, but in a way that causes irreparable loss of erectile function, fibrosis, and nerve damage. It's more than just theory. Basic vascular biology is that. Consider it this way. What would happen if you didn't move your legs at all for 6 months? You would lose your flexibility, coordination, and muscle. You may even lose your ability to walk. The penis is subject to the same rule. It does more than simply go on standby after a certain age. When it is not in use, it begins to shut down. What's the worst? There is no strong warning about this decrease. It's creeping and silent. It's not until it's too late that you realize. You discover one day that you no longer get morning erections. Then, even fantasy or physical contact is ineffective. Because the foundation has already been damaged, the body eventually stops responding as it once did, even with medication. Men have sat across from me with tears in their eyes and asked if they could have it back. Some do, with medical assistance, lifestyle modifications, and vigorous therapy. Others, no, they were waiting too long. They believed that stopping masturbating was a sign of self-control and was harmless. In actuality, however, it was the silent start of functional decline. And I want to be clear, this has nothing to do with having a sex obsession. It's about safeguarding an essential component of your hormone balance, circulatory system, and manly identity. You may keep the blood flowing, the nerves alive, and your body reminded that this function still matters by continuing to engage in solo activities occasionally, even once or twice a week. In actuality, you begin to lose what you don't use. And that loss may be irreversible as you age. I've witnessed it destroy men. It affects their feeling of self-worth, relationships, and masculinity, not because they're attempting to impress anyone. What's the most tragic then? It may have been avoided, totally avoidable. It just needed to be consistent. Attention, not indulgence. The majority of men are afraid of losing their erections, but many are unaware that this is only the first step, because the next effect of stopping masturbating has a deeper impact: your hormones. And the consequences extend well beyond the bedroom once they start to crash. Allow me to demonstrate how. Usually it begins quietly. Each of your subscriptions is big motivation for me to create more high-quality videos. A man can't quite explain why he no longer feels like himself. He skips his walks, his appetite shifts, his mood becomes flat, and he is less eager to get out of bed in the morning. Throughout the day, he feels more worn out, agitated, and reclusive. He also has a gut feeling that something significant is going away, but he is unable to identify it. I've had males in my clinic blame it on stress, aging, and poor sleep. Deeper investigation, however, frequently reveals the same underlying problem. Their testosterone levels have decreased, not only as we age naturally, but also more quickly due to the total lack of sexual pleasure. What most folks don't hear is this: one of the few non-pharmaceutical methods available to elderly men to increase their natural testosterone production is masturbation. It has nothing to do with fantasy or sex. It has to do with biology. Your brain sends signals that help control your hormonal rhythm when you regularly engage in arousal and release. The hypothalamus becomes active as dopamine levels increase. Additionally, your testicles continue to produce testosterone even if you are in your 60s or 70s. However, your body gets the opposite message when you completely cease that process and go weeks or months without having sex. It reduces hormone production because it believes closeness is no longer necessary. And it might be challenging to break that cycle once it starts. Men who have low testosterone experience more than just fatigue. They start to become less themselves. They are unable to concentrate. They stop caring about the things that used to make them proud. Their muscles start to deteriorate. Their bones grow weaker. Their susceptibility to depression increases. Their cardiovascular risk also rises, increasing their risk of heart attacks and strokes, possibly the most hazardous of them. In a matter of years, I have witnessed once vibrant men turn into shadows of their former selves, not because they were ill, but rather because they were never informed of the importance of regular, healthy sexual stimulation for hormone maintenance. Feel free to leave a comment below, starting today, to ask any questions you may have. Don't forget to hit the subscribe button and turn on notifications so you never miss the best health tips from Age Defier. And if you're watching right now, I want to know if you're following me. Type 1 in the comments if this video means something to you. Type boom if it doesn't. The gradual loss of a man's vigor due to carelessness rather than illness. Unfortunately, he's not alone. One of my patients, a retired firefighter, told me that he started to feel unimportant once his hormone levels fell. I'm still thinking about what he said. I don't even recognize the man in the mirror, doc, he added. I will always remember the expression in his eyes. It wasn't conceit, it was sorrow, and this was not necessary. He might have saved not just his hormones, but also his happiness, vitality, and drive with a little education and a simple habit he believed was wrong. Because this is the harsh reality. If your testosterone levels return at all after a decline in old age, it may require years of treatment and thousands of dollars. However, you can maintain the line longer than most people believe if you participate in your own closeness, steadily and respectfully. The next consequence is something that every guy experiences in a far more tangible, occasionally painful way, even though hormones are frequently invisible. A disorder that slowly develops deep within the body until it begins to interfere with day-to-day functioning. And the majority aren't even aware that it's connected to a single, easy item they've stopped doing. Let me clarify. Older guys don't often discuss a certain type of difficulty. A dull, heavy pain in the middle of the pelvis, an odd pressure after prolonged sitting, or the constant want to urinate even when the bladder isn't full. Like a heart attack, it doesn't happen all at once. It develops gradually and subtly until it begins to interfere with your day-to-day activities. Additionally, most men have been dealing with it for months or even years by the time they bring it up to their doctor. The startling thing is how frequently this unsaid pain may be linked to a single disregarded cause. Lack of ejaculation results in prostate congestion. In the male anatomy, your prostate is more than just a bystander. Seminal fluid is produced and stored by this active gland. The fluid is supposed to flow. It should be flushed. That fluid sits after you stop masturbating or having sex altogether, especially as you age. Additionally, it thickens as it sits. The pressure increases. Inflammation begins to develop. At that point, you begin to notice changes. Reduced urine flow, lower back pain, and that persistent urge to urinate that keeps you awake at night. As a urologist, I can't even begin to count the number of elderly individuals who see me believing they have a bladder problem only to find that they actually have an irritated, inflammatory prostate. Frequently, medicine is not the answer. It's motion. Regular ejaculation is the body's natural way of detoxifying, and there may be dire repercussions if that process is neglected for an extended period of time. A painful chronic inflammation that is difficult to treat and even more difficult to live with, chronic prostatitis affects some men. Others discover that in order to feel normal again, they must undergo invasive operations. In addition to the physical discomfort, most men are unaware of another level of danger. Regular ejaculation has been linked to a decreased risk of prostate cancer, according to research, including a well-known Harvard study. The theory is straightforward. The accumulation of potentially dangerous chemicals is decreased when the prostate is routinely drained. However, letting that fluid sit for months at a time can raise the risk of long-term complications and inflammation. One of the men I worked with had not had sex for over 2 years. He informed me he didn't feel the need and believed it was over. However, we discovered severe congestion when we conducted additional testing when his PSA level increased. His prostate was irritable and swollen, and he was having to deal with biopsy conversations when something as easy and natural as maintaining occasional release may have prevented it. This has nothing to do with promoting excess or passion. The goal is to avoid suffering. It's about realizing that after age 60, the male body still requires care. It needs more care, if anything, more deference. One of the organs in older men that is most at risk is the prostate. And the harm is more than just discomfort when ignored. It might change your life. The ultimate effect is more profound, even while a clogged prostate may result in discomfort, irritability, and long nights spent rushing to the bathroom. It goes right to the heart of a man's self-perception, and it's the one that many people don't anticipate until it's already established. I'll demonstrate what I mean. Of all the declines, this one is the quietest and frequently the most destructive. The decline is the same for thousands of older men each year. In sexual function, strength, and emotional clarity, all the while believing that giving up what they believe they no longer need is the correct thing to do. Men have been warned for decades to avoid self-gratification because it is immature, shameful, and pointless. Yet once you reach the age of 60, that mentality can cost you everything in silence, because nobody is speaking out loud about this reality. Blood tests don't reveal it. There is no easy way to measure it. However, you sense it deep within, a gradual loss of the spark you once possessed, a nagging feeling of alienation. You can't fully articulate the disconnect you have from yourself. It takes time. You believe you no longer need to masturbate, so you stop. When you're not in a relationship, you tell yourself it's just the way life is, or that it's age or a lack of desire. But in the long run, that choice impacts more than just your physical health. It penetrates your thoughts, feelings, and basic sense of existence. Men have told me they feel empty on the inside. Not because they are ill or in agony, but rather because they have gone months or even years without intimacy or any kind of relief, even with themselves. They also gradually start to feel invisible, not wanted, not necessary. Of course, they don't discuss it. Most guys in their later years were never taught how. However, it is evident in their gait, in their avoidance of mirrors. When you ask them how they're doing, their voices become quieter. It has nothing to do with sex. Vitality is the issue here, about the delicate yet potent relationship between your mental health and your physical health. Giving up self-pleasure completely cuts off one of the last routes to happiness, self-awareness, and human connection. And that's more than simply a loss for guys over 60. It's a wound, for arousal, pleasure, and release are not limited to young people. They contribute to the health of your emotions, hormone balance, and active brain. Dopamine, oxytocin, and endorphins, chemicals released during masturbation, are crucial for mood regulation, anxiety reduction, and emotional stability. Men are more prone to suffer from loneliness, sadness, and even cognitive decline if they don't have them. I have witnessed men who were once self-assured and outgoing gradually becoming aloof, reclusive, and uninterested. They stop connecting with a part of themselves that used to make them feel alive, not because their lives altered radically. And this is the reason it's so dangerous. A lot of males are unaware of this link. They never attribute the emotional numbness to their decision to cease intercourse months ago. The harm has already started by the time they experience the consequences. And it takes more than hormone medication or a change in routine to reverse it. Rebuilding your relationship with oneself is necessary. Keeping in mind that your body still craves connection, expression, and feeling, even as you age. The outcome that hurts me the most is this one, because it is the one that, without the man's knowledge, takes away his dignity. It removes the warmth he once provided, the serene assurance he once carried, and leaves behind a shell he no longer recognizes. However, I want every male to hear this reality. Returning to oneself is something you can do at any time. It's never too late to bring back the vitality you believed had vanished. And I'll walk you through the process in the last segment of this video. The easy, scientifically supported actions you can take right now to help older men regain what they have lost and what you are still able to defend. Together, let's get this done. Many older guys have this belief that you grow out of connection, pleasure, and desire, that your body is meant to become quiet beyond a certain age, that giving up that aspect of oneself is honorable, perhaps even admirable. However, I can tell you that this idea is losing far too many men their identity, happiness, and health after working with men in their 60s, 70s, and beyond for more than 30 years as a doctor. You have heard today that ceasing to masturbate might cause your sexual function to gradually deteriorate, your hormones to plummet dangerously, your prostate to grow and inflame, and you to become emotionally numb and mute, which weakens your spirit every day. These are not minor adjustments. These are transformative changes brought on by neglect rather than age. Fortunately, things don't have to be this way. Every time you hit that subscribe button, it truly would be by yourself. It truly motivates me to keep going and to put even more effort into creating valuable, high-quality videos for you. Your support means the world and helps this channel grow stronger every day. Your body is still able to recall how it feels. Your mind still craves interaction. And you still need to respect every aspect of yourself if you want to be healthy, including the parts that nobody else sees. It has nothing to do with lust, it has to do with life. Your body doesn't simply pause when you stop masturbating as you become older. It starts to break down. Your prostate becomes inactive. Your testosterone levels plummet. Your ability to bounce back emotionally deteriorates. And you've already fallen behind by the time you experience the consequences. As a board-certified urologist and men's health specialist with more than 40 years of experience, my name is Dr. Mohit Khera. Assist older men regain their vitality, self-esteem, and quality of life. Preserving your sense of strength, wholeness, and humanity is the goal. You don't have to feel bad about prioritizing your health over keeping quiet. I encourage you to consider this message seriously if it struck a chord with you. Don't take it personally, due to the fact that it is personal. And I'm with you if you're prepared to regain control over this aspect of your life. You're not by yourself. You're not finished yet. If even a small part of this message resonated with you, please put 1 in the comments section to let me know that you're still here, that you care, and that you're still working to improve your health. And it's also acceptable if it didn't. Tell me what you need and type 0. In either case, your voice counts. You're not alone either. I've sat with grandfathers, teachers, farmers, and veterans who all believed that abstinence was the proper thing to do. And when the damage eventually caught up with them, I saw the silent remorse in their eyes. Because the majority of them were unaware that the behaviors they adopted decades ago, behaviors that society deemed shameful, were now subtly backfiring at the most crucial years of their lives. However, there is good news. I'll go over the 4 actual health repercussions of stopping masturbating as you get older in this video. Furthermore, how to stop them before it's too late is more crucial. Thousands of my patients have employed these easy, doable, and safe medical methods to protect their sexual health, regain their vitality, and steer clear of typical problems that most men assume are simply aging. And don't go until the very end, since the final consequence I'll discuss is one that even the majority of doctors avoid discussing. It's also the one that, if ignored, might subtly increase your chance of prostate problems by 3-fold. You'll want to hear it if you're concerned about safeguarding your physical well-being, self-esteem, and independence as you become older. If you're viewing at the moment, please leave a remark with a score of 1 if you agree with me or 0 if you don't. Both are welcome, since older guys should have this discussion, with genuine responses and without embarrassment. Let's start with the first and possibly most dangerously disregarded effect of ceasing to masturbate as one ages. More times than I can remember, I've seen it. The perplexed and irritated man in his late 60s or early 70s enters my office. He informs me that it has been months since he last experienced a spontaneous erection. At times, more than a year has passed, and it's not the lack of performance that most disturbs him. It's the abruptness of everything. He felt like himself one day. Then something inside simply stopped functioning. Most males are caught off guard. Why? Because no one ever warned them that their sexual function would disappear like an underutilized muscle if they stopped having sex. Let me state it simply. Your penis is more than simply a decorative item. It is a useful organ that needs to be regularly circulated in order to remain healthy.